Welcome, guys, back to the episode 66 for the Rimm-PODCAST. I'm your host, Iggy. Today, it took me a while to get this doctor on the podcast show. Now I know how much he's busy. He's really well known in the Central Florida figure. And today you will learn a lot about gut health, gastroenterology, how much is important that you check yourself on time, that you do certain things to prevent, I see a lot of people, they're waiting too long and then prevention is low. So check yourself up. So I'm gonna say a little bit about the doctor, and please like, share, join, comment, invite other people who will love, because I believe we can change together we can save the lives. Basically, we can save the lives. That's all what it is. But doctor is really well known. He's with the digestive disease. He's been with them for many years. He specialized in the gastroenterology, and then I don't want to say too much because I might say something that the doctor will love to hear, or doctor will say, listen, this is who am I, this is what I do, and this is why I became the gastroenterologist. So Dr. Zapatier, welcome to the show. Thank you so much for being with us today.
Thank you.
Tell us a little bit about yourself, who you are, and why you even decide to go to the gastroenterology field.
Well, thank you for the invitation, Igor. Yes, it's an honor and be able to, participate in your podcast. So I've been in the field. I've been practicing gastroenterology for 12 years now.
Okay.
How this happened, I don't know. I think it was just, I always say imprinting. So it was like early in medical school, I got exposed to digestive diseases. Initially working with a surgeon.
Okay.
And that was it. Immediately, that was everything that I wanted to do. And then slowly transitioned into clinical gastroenterology and got into the assessment and the investigation of digestive complaints and the endoscopy. That the diversity of the field of gastroenterology is something that really got me, and gives me a lot of passion. I joined Digestive Disease Consultants in Altamont Springs about 5 years ago. And we are just trying to make a dent in the community and move forward.
And they are really well known practice with multiple locations in Central Florida.
Yes. We have an office in Oviedo, another in Lake Mary, and we'll see where the future takes us.
I just have one quick question before we jump to the questions. Like, it's an old saying. Everybody's talking about gut. They always say it's not here, it's in gut. Can you tell us what the gut is?
Well, gut, I assume people refer to the what we call the gastrointestinal tract, right? So all the pathway of the food and nourishment all the way from the mouth, its pathway through different segments of the digestive tract, and in every segment something different happens to the food with the goal to eventually absorb nutrients, and anything that is waste will eventually go out from the rectum and anus. There's a lot of things happening during that process. There's every segment has a specific function, is a specific regulations, and if any of those regulations fail, patients have different type of symptoms. When you have so many things working together for a specific goal, and if one piece misses, then a lot of things can go wrong. So I assume that's why there's a lot of interest in digestive field at this point. It's probably, as you said, everybody has some type of digestive concern at some point.
Yes.
And how do you differentiate when it's something mild that you can just go to the pharmacy and take care of it, and when you should go and seek help and talk to a specialist, and sometimes even have tests and procedures to fix your problem? I think that is in the minds of a lot of people. Like is what is happening to me. Yeah. So I think is with education.
Education is everything, power. And another thing, like when we feel like obnoxious, anxiety, depression, anything like related to the symptoms that people feel like either happy, not happy, we always feel here. So my question is like, does the signals go more from here to here or from here to down there?
Well, I think it's both ways.
Both ways?
Yeah, so the concept of the gut-brain axis was already presented a number of years ago, to just make note of the strong connection between the brain and the gut. To the point that, as you said, very often the gut is the outlet for whatever mental stress we're having. Some patients are more susceptible for that, especially people that has been exposed to trauma that deals with anxiety or depression disorder, etc. And sometimes it's both ways. Sometimes the discomfort can generate more concern and more anxiety, which eventually can become a vicious cycle. Like, okay, my gut is acting out, creates more stress, and that stress manifests more in the gut, and so forth. And it's often a vicious cycle that is very tough to break, and it involves comprehensive history and assessment, sometimes multiple testings, and persistence. Because with patients that deal with that, you have to talk, you have to spend time with them, you have to try to break down. And again, I love this expression, the devil is in the details, and I think that applies a lot in gastroenterology. When you have a complex a complex symptom, a complex medical question, and really there's no way to get to the bottom unless you take a deep breath, sit down, and
slow down,
spend the time and break it down. Okay, so tell me from the very beginning what happened.
What's happened? Yeah, that's a good one. So now I love this conversation. People, how? I don't know if you can answer this question or not, but because you're a gastroenterologist, because all of the foods goes through the different part of the body, and then before they observe, like you said, nutrition, important cells and stuff, and they do their job. The other ones, toxics, they need to be out. So how is it important not to eat prior to going to heavy meals? Like, because while you're sleeping, your body is like, is it functioning or is not functioning? It's good to eat like a steak at 10 o'clock, 11 o'clock at night, and you're sleeping at 11 o'clock. How hard is for our body to absorb the food over the night while you're sleeping? Which is not the same when you are during the day, you're kind of moving in and out.
True. So your body has all these.
But don't just go on. I'm not against the steak people. I just want to make sure for myself and people who wants to stay healthy. I wish all of us want to stay healthy.
Okay. Well, you ask if I can, so I can't answer this. No,
okay.
No, just kidding. No. So a lot of the things that happen with your gut under the turf of a segment of your nervous system called the autonomous nervous system, which is in function of all the things that happen that you're not conscious about. And digestion has a lot to do. Yes, things change when you're awake, and then when you're asleep, when you're moving, when you are sedentary. Your diet, whether it's just low fiber versus high fiber, etc. All those things can affect your digestion in many ways. But as long as there's any problem or any specific medical condition affecting that function, your body should be able to process the food, and digestion happens, and eventually get rid of the toxins or the bowel movement, etc. Now, if you do certain things, your body may not like it. So if you have a very big,
heavy
greasy
meal.
Ribeye with a glass of red wine at 10 at night, you may get bloating. You may get acid reflux. You may have a bout of constipation the next day, or things may happen. Not to everybody, of course, but those are things that can happen depending on the choices that we make.
Got it. That's a great. So now, are there any lifestyles or dietary changes that you recommend to patients to prevent digestive issues from arising?
We don't have any specific. So there are specific diseases that have a specific diet.
Okay.
So from taking that aside, as a general recommendation, I think falls into the same recommendations from other specialties. Other specialties will do. You know, avoid processed foods. Have a very well balanced diet. You know, veggies, fruits, tree nuts if you're not allergic, complex carbohydrates, healthy fats. Try to, you know, don't overdo with the calorie count. Stay physically active. Drink plenty of water. Is recommended an average of, you know, 2 to 3 liters of water per day. And make sure that the balance, you know, your diet itself includes an adequate amount of fiber, natural fiber preferably. The recommendation was anywhere between 20-25 grams a day, depending on your gender. I don't know if that still applies.
Yeah.
And again, say physically active, avoid sedentarism. I mean, I think those are general health
Rule of
recommendations that at least we know that your colon health is going to be better, your digestion probably is going to be better. Some patients even come to you and they had symptoms for years, and the moment they decide to make a radical lifestyle change, they come back to you and said, well, I didn't take the pill you gave me, I just did this diet, I've been running, and I feel top shape.
Great.
And you're like, great.
Yeah. Good.
So it matters. I think that, again, taking aside those specific medical conditions,
yes.
I think that's probably a general recommendation.
So now, since you give us a lot of analogy and a lot of the discovery call or discovery conversation, what God does, what should we do? Now tell us what are the most common digestive diseases that you treat, and how do they affect patients' quality of life?
Oh boy. Okay. So probably the 2 most common conditions that I see on a day by day is gastroesophageal reflux disease and constipation.
Okay.
In both of them, the spectrum of severity is very wide. You can have a very mild patient that, you know, has heartburn when eats the ribeye and takes Tums and everything feels great.
Yep.
And you can have the patient that has constant burning, they can't swallow well, they're losing weight, they can't sleep, they regurgitate every time they lean back. And so when you said about the quality of life, I guess depends on how far into that spectrum of severity they are. And again, that is when it's important to pay attention to the details, and have this clear idea that when the quality of life is getting affected, so you can escalate the degree of how aggressive you want to handle this specific case, right? Most patients deserve, like, okay, I have this symptom, right? You screen the story, you make sure there's no red flags, make sure there's nothing there that may sound concerning or impose any risk. And if there's no such a thing, you can be quite conservative, like, you know what, take this pill, do this, check this out. But if something changes, or if you notice that they are, as you said, they are not sleeping because they're terrified of their symptoms, or they lost 20 pounds, or they just can't sleep, or something like that, then you have to be aware of that and know when to escalate the aggressiveness, because, okay, this patient needs help, or I'm concerned about this, let's go ahead, let's do an endoscopy, let's do this special testing and so forth. So quality of life can be affected quite significantly, either by common symptoms. And constipation is pretty much the same mental process. It's can be mild, like, you know, I didn't eat my kiwis today, and now I didn't poop in 2 days, versus I have not had a bowel movement in 10 days.
A question, like when we come to the bowel movement, which is really important. Bowel movement is like how often a healthy person should have a bowel movement, and at what level that when people said like 7, 8, 10 days they don't have a bowel movement, how risky is it? It is.
Well, risky.
Like it's not the same when somebody has it every day.
Well,
and somebody don't have it for 20 days. I mean, for 20 days, can you imagine?
Well, the risk is that for patients to develop what we call an impaction. An impaction is like whatever stool they have gets completely stuck, typically in the rectum. It can happen in any part of your colon. And if you have an impaction, then those patients suffer quite a bit. It's like a semi-obstruction of the colon, and it's very painful. Some of those patients end up in the hospital.
Yeah, then they have to do.
Sometimes you can, relieve it with medicines. That you have to.
Sometimes you have to do.
You have to do
devices,
something to relieve the obstruction, right? And there's more the considerations in that specific scenario. That's in terms of risk. In terms of, patients can go many days without having a bowel movement, and and that can be very uncomfortable. It's definitely very uncomfortable for them. Some patients adapt. Some patients get used to it. They're like, I don't poop in 5 days. It's okay.
It's a common thing.
It's common. I don't mind. So it again, there's a lot of variability and diversity in the way that they present.
But in general,
so let's talk about the clinical concept of constipation.
Yes.
So it's and this is probably a common misconception. Is looking at constipation only as frequency.
Okay.
Like, I poop every day, so I'm not constipated. But they complain of bloating and when you ask, okay, so tell me about your defecation. I mean, do you go daily? Yeah, but tell me about your stool. Is it normal?
Yeah.
Does it have a good size? Oh, no, it's like a tiny little pellet like this. It's like, okay.
That's not good.
You go daily, but it's a tiny pellet, right? Do you feel that you empty out completely? No, I don't. How much time do you spend? No, I spend 45 minutes training. Wow. So frequency is not the only thing that we assess. So when I talk to patients and I present or I ask about it, I ask in terms of colon emptying. If I use constipation, a lot of times they fire back like, I'm not constipated. And I'm like, okay. Let's talk about colon emptying. Do you think that you empty your colon? Well, so then you ask, and the clinical definition is in terms of frequency. If you don't move your bowels, in more than 48 hours, it's probably clinically significant. If the consistency is what we call, and we have something called the Bristol stool scale. It's like a nice cartoon representation of the stool. So it is tiny pellets. It's a Bristol 1, which is the most severe form, and then you have 2 and 3, which is harder, compact, lumpy stools, etc. So if they tell you more into Bristol type 1, if they spend 10 I think it escapes the exact number of minutes, but if they spend, I would say, more than 5 to 10 minutes trying to have a bowel movement, that's clinically significant, or the sensation of incomplete emptying. Okay. Like they finish the bowel movement, but they still feel like there's more there. It's just not coming out. Then I would say, you're constipated.
Okay. Now I know technology is moving like never before. By the time we develop, initiated on one particular device, by time fully get developed, somebody already come up with another one. So my question, can you share some of the latest advancement with the treatment of digestive diseases? And are there any new therapies on the horizon that could change patient care?
Oh, wow. Yes, there's a lot of things. So let's break it in. So there's a lot of progress in pharmacologic therapies. Okay. Specifically in inflammatory bowel disease, Crohn's and ulcerative colitis. There's a lot of change in the natural history of the disease. These patients used to suffer, had a lot of surgeries, many hospitalizations. Now with the newer medicines, a lot of them are injectables. They have normal or semi-normal quality of life. And every generation of drugs comes cleaner with better efficacy, less side effects. In metabolic liver disease or fatty liver disease, which is becoming the most common or one of the most common causes of liver cirrhosis, there are newer medicines that are actually regressing the scarring and the fibrosis in the liver caused by that chronic inflammation. So that's a huge leap forward. We didn't have anything before that. And there's all other advancements, but fatty liver disease and IBD are very common conditions. In terms of procedures, and with endoscopy, newer techniques and technology allow us to do things that in the past required surgery. Okay. For removal of very large polyps or specific conditions that in the past needed a surgery. Now patients can have treatment with the same efficacy, with no need for surgery, meaning less risk, no hospital stay, etc. So that's non-invasive. least invasive. So that's a huge leap forward for advanced GI
Got it.
diseases.
So I want to at least the last question, like because you do a lot of research and you are a young doctor and you still have many years in front of you.
I hope.
Yeah, to work, do a lot of research and treat a lot of patients. And I'm like I said, I'm really glad that I met you, that we're actually doing these things together. And down way in the road, I'm definitely looking for more, even involving more of your colleagues.
Oh,
Maybe
yes.
jumping on the virtual, so that way we can reach more people. Because the schedules is all about schedules. But my last question would be like, how do you see the future of digestive disease treatment evolving in the 5 to 10 years? And are there any exciting research trends that you are following? And if you could be so share with us.
So I can come up with a couple of examples or ideas. One is there's a lot of studies into the microbiome.
Microbiome.
I think we're in like diapers stages.
Yeah,
That's my personal opinion. We know that it exists. We know that it is associated with certain medical conditions, sometimes common medical conditions. We know that it can change with your diet or how you feed yourself or how healthy you are. But we don't know how to use it to diagnose diseases, and we don't know how to manipulate it to give you a health benefit. So I think that there's a lot of room for development there.
For advancement.
And the other would be, going back to inflammatory bowel disease, is the use of more into the genetic assessments. Like we have this medicine, so there's diseases that they are, the way they behave depends on your genetic predisposition. And although the patients manifest the same, they have many, many, many different genetic pathways that can lead to how they respond and all. So right now we have medicines, but we don't know which medicine will target your profile. So if we're able to, let's say, identify, yes, you have this disease, and this genetic pathway means that you're gonna react this way, you need this medicine, then you avoid yourself a lot of trials with different drugs that may not need it, and give you the specific treatment that you need based on your genetic profile.
And how much do you think the AI advancement would help the doctors?
I hope that but this is more. It sounds to me like a laboratory technique.
But catching different things like patterns of the history.
I can tell you that in my life, when I do things with AI, I can do things faster.
Oh,
I just can imagine that in research, people they are doing wonderful things, or doing things that used to take years, maybe doing it in weeks or months.
Yeah, but the knowledge deplete with the AI, because now you are focusing more on the technology and things, and then you are not uploading so much information on your brain that you can actually develop a better skills. You just relying totally on AI, which I'm seeing kind of interesting, but at the same time, as generations are becoming more distracted.
I think it's going to be a two-edged. First of all, I don't think it's nothing stopping it.
Nothing.
I think it's a two-edged sword, and I think that there's going to be some abuse. But I think the potential to harness that into your efficiency and your ability to understand better the things around you, I think is there. So I think probably the best way is just like when the internet came, right? I think the best way is just to jump on the wagon and learn the best way, the most ethical way to adopt this technology. And that's my personal, very personal
thing, of course. So now, I always said my last one is look it up in camera. Camera is right there, and tell the patients, as a doctor, as a gastroenterologist, what they should do with their gut health.
Okay, that's a very, very okay. So gut health.
Yeah.
So my wife has this expression that says, "You are what you eat," or I think it's like that. But I'm sorry, honey, if that's not how it is. But I think diet is probably a very important thing that we can focus. I think at this point the information is out there of what is actually healthy and what is not. The verdict is out there for processed foods, and unfortunately that's everywhere. So kind of educating ourselves in what are the things that can get us in trouble down the line, adopting a lifestyle that is going to allow us to have a better quality of life, and enjoy, the time with ourselves and with our loved ones. I think it's worth to look into. I know there's a lot of good, delicious things, but I feel that food is engineered to be delicious at the sake of people's health. So that would be my advice: is be very careful of how you feed yourself, and that if you notice that things are not right, then seek help. Bleeding, seek help. Waking up at night with digestive issues, seek help. Don't wait till the last minute. There's a concerning rise in severe diseases, even colon cancer, especially in younger people. So if there's anything that just doesn't feel right, please talk to your doctor about it, and good luck.
And like I said, my fans, my followers, my members, my family, colleagues, and everybody who actually watched us over the last 4 years, he said everything. So all you gotta do, take care of your health, and if you see certain symptoms that you don't feel great, please reach out, because like I said, if you're waiting for too long, it's gonna be too late, and you don't wanna get to the late episode of your life and discover something. Sometimes you can give yourself another 8 to 10 years of living if you do the right thing. But like I said, doctor did his job, I did my job. It's your job to do your job, and listen to information, share, comment, invite all of your friends. Like I said, he's a great doctor. He's been really well known. Digestive Consultant Disease is really well known in Central Florida. So doctor, thank you so much for joining us today.
Thank you
Looking
for
forward
invitation.
again, sharing information. I'm really enjoying your conversation. Like I said, we can go this for an hour. It's such a great information, and but I would love to do this in a more often segments.
Okay.
So that a lot of different audience can adopt, because when you come at gut health, mental, we can talk about that for a million years.
Well, yes, absolutely.
Yeah. So thank you guys. This is your host Tiggy. This is our special guest, Dr. Zapatier from the Digestive Disease Consultants. He shared a beautiful information. Please, if you have any issues, visit them. They are in Altamonte Springs, and a great facility. I went there. Great care, great doctors, and a great staff. So thank you very much. We wish you the best, and thank you.